Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers coming to you from the Detroit Regional Chamber Mackinac Policy Conference taped at the Grand Hotel. Our topic today is the role of healthcare in Detroit. Joining us now to talk about it is Nancy Schlichting, the CEO of Henry Ford Health System. Thank you so much for joining us today.
Thank you. It's a great opportunity.
Well, certainly when we talk about the role of healthcare in Detroit, in particular the city of Detroit, Henry Ford Health System is intimately involved, building, expanding, innovating everywhere we look.
Absolutely. We've had a goal for the last several years to be part of the solution for Detroit and really look for ways that we can collaborate with other organizations as well as to innovate in a number of important areas. One of the most important has been our Midtown Collaborative with the Detroit Medical Center and Wayne State University. We're focusing on living in Detroit. We've now had upwards of 500 new residents, 70% of them from out in the suburbs and out of state, who are coming to live in our Midtown neighborhood, and we're really excited about that. And we also have a new innovation institute at Henry Ford Health System that is collaborating with, actually, again, the School of Engineering at Wayne State, as well as the College for Creative Studies. And this is an amazing opportunity for us to actually create new design products as well as new clinical innovation and really translate that into jobs and new businesses for Detroit.
You mentioned all the new people moving to Detroit, and you always sort of hear that the key to get people to move and live in Detroit is first you have to have jobs and somewhere for them to hopefully work downtown. That's a huge draw. And as you build, as you mentioned, the Innovation Institute, and I know you're developing other properties as well, more and more jobs being created every day.
Absolutely. We've grown, actually. Henry Ford in the last 10 years has doubled our employment. And that has included the city of Detroit. And we know that many young people and empty nesters want to live in the city. They like the urban core, and they're really enjoying all the great cultural institutions, sports, and other activities, and great restaurants that are popping up. But we also have 300 acres south of the boulevard, basically where Henry Ford Hospital is, that we're developing. And we just announced recently a partnership between the Detroit Medical Center and Cardinal Health out of Columbus, Ohio, to build a new distribution center because we both use their products, and we want to have, again, more jobs in the city, and this will help us really launch that new development of 300 acres, and we hope to have housing, retail, and commercial development as well as expansion of the Henry Ford campus over the next 5 to 10 years.
Since when did healthcare become so much more than healthcare? It's, you know, we're not just talking about going to your physician's office, going to the pharmacy, a stay at the hospital. You're mentioning retail and distribution centers, and it is just a tremendously huge industry.
It is. It's a big sector of our economy. That's part of it, our dilemma today, because we're trying to reduce healthcare costs, but at the same time, we're contributing. We're part of the economic engine of the city, of the state, and of the country.
Well, what a wonderful time for the growth of healthcare as we do see our aging baby boomers needing to take advantage of the types of products that our healthcare industry offers. And certainly there's a demand out there for those types of jobs as well.
Absolutely. There's a tremendous demand. And frankly, they're great paying jobs. They have great career growth, and obviously they serve a population that needs what we do. And it provides tremendous meaning and reward for all of us that have had the privilege to serve in healthcare for many years.
For folks who are not intimately know all the ins and outs of the Henry Ford Health System, you're not just in Detroit. You're sort of everywhere, and different sort of satellite buildings all over the Metro Detroit area.
Henry Ford Health System actually is a $4.3 billion organization with 24,000 employees, and we are located in over 120 sites throughout the Southeast Michigan market, and we serve a population of over 1 million people a year.
And you mentioned doubling, I think you said, the number of folks in the last 10 years. What are your plans for the next 10 years?
Well, we have an exciting vision, really, for how we can be, again, part of this whole health reform movement, how we can change healthcare, make it incredibly customer service oriented, very high quality, and lower cost. So we're looking for new models of care that can really help us in this transformation process.
All right. Thank you so much for joining us today, and certainly for all your hard work as we see the health system grow and, as you mentioned, innovate as well.
Thanks so much.
Today's Comcast Newsmaker was Nancy Schlichting, the CEO of Henry Ford Health System.